Hi, guys. My name is Rip. Thank you so much for joining us all today. And thanks for everybody that's coming live. I'm a locums tenens physician. I live here in Houston. I work at the Baylor College of Medicine part-time, and then I do full-time locums work with a few agencies and a few places on my own. I've been doing locums for about 5 or 6 years. And today we're going to have a discussion with two physicians about their experiences abroad in New Zealand before and kind of during the COVID pandemic. Before we start, just a few housekeeping items. You can't be seen or heard, and so you'll be able to submit questions, and then we will try to bring those to the loop for the actual discussion itself. If you're having any issues with technical problems, just log in and then log right back out. And we're actually recording this entire webinar. And so if you want to look at it later or send it, we'll have that link available later when everything is finished. So that should be it. I just want to introduce our two speakers, Dr. Jenny O'Driscoll and Dr. Diane Weissman. If you guys just want to talk a little about yourself and your background, why don't we start with Dr. Weissman?
Hi, everyone. I'm Diane Weissman. I'm a family physician, and after medical school, I did a lot of work in community health centers, and I also worked for Indian Health. And around the time that my daughter was graduating from high school and going to college, I decided to try some international work. I had grown up in Latin America. I was actually born in Chile. My mother is Chilean. And I really had a desire to get back out into other countries of the world. I also have a background in anthropology and social work. And given my work here with Native Americans and underserved populations, including immigrants, refugees. It was very attractive to me to be able to go to New Zealand and work with the Maori population. So that's what I did for 9 months. I got back at the end of May.
Great. Thank you, Dr. Weissman. And Dr. O'Driscoll, do you want to tell us a little about your background and sort of starting into locums work?
Oh, I have to make sure I unmute.
Yeah.
Oh, yeah. Hi, I'm Jenny. I'm from Toronto, Canada. I always wanted to, ever since when I graduated residency in 2013, I was always on my radar to try to do an international locum. I did a lot of locums in Ontario, family practice and emergency medicine. So during my first 3 years, locumed all over Ontario. But I just never kind of committed myself yet to do a international locum. It was always on my radar, but I just never fully committed. Then I had 2 babies, and then that window kept kind of narrowing and narrowing and narrowing. And then when I had my second child, I said, okay, we just got to do it, because if we don't do it now, then it's like the opportunity that we won't be able to do it until later. So that's what made us to like take the leap and try to go to New Zealand. We only went for 7 months. I wish we went longer, and me and my family also came back at the end of May.
That's great. Thank you, Dr. O'Driscoll. I do locums mainly in the United States, so more in South United States. So I've never done locums abroad, though I know Dr. Weissman has done a lot of international work as well. So I think a lot of people are very interested in this topic, and as a hiatus to a career, maybe moving there, something full-time, experiencing a different culture, and really comparing our two healthcare systems together. Dr. Weissman, what got you into international locums? How did you hear about it?
So I think, like many others, I learned about it years ago, and specifically about global medical staffing, which, places, doctors abroad. And I think I probably first connected with them at a conference and stayed in touch. I actually was going to pursue it earlier in my career, but again, I think the timing has to be right because, you know, it's difficult when you own a house and, you know, you have a child in school. There are a lot of considerations about the school year calendars being different and so forth. So it had been on my radar for years. And when I first left my full-time job as my daughter went off to college, I did some humanitarian work. It was basically volunteer work that I did in India and then in Panama with floating doctors. And getting into international locums was a way that I could have a different experience. I could still work with, you know, a needy population and yet have some of the benefits of, you know, being employed for a while. So I contacted them, and the process takes some time because of course you have to wait to get licensed and so forth, but it really doesn't, for New Zealand, it doesn't take much longer than getting licensed in another state here in the US. So the process was really quite easy. It was, the hard part really was sort of choosing a location and you know, once that was done, the rest was easy.
Do you want to talk just a little bit, Dr. Weissman, just very briefly about floating doctors? I don't think I've ever heard of that organization.
Yeah. So Floating Doctors is a humanitarian organization. It's based here in the US. And at this time, they've worked in other countries in the past, but at this time they're working in the islands in the Bocas archipelago of Panama. And it's a fascinating work because you are based on you live on a base on one island, and then you go out literally by canoe to indigenous communities to deliver primary care. And so, you know, every day of the week, pretty much, you're going to a different community, a different island, and they sort of have a rotation through these places. And they work solely on the basis of volunteers. And so I was technically a staff person, which is kind of like a volunteer that receives a stipend and is there for a longer period of time. I was one of the lead medical providers. And then they also have volunteers that will just go down for short periods of time. I was there for 6 months, but some people will go for, you know, just a few weeks.
Well, a good pitch. I know people interested in this line of work are also looking to find opportunities to fit humanitarian work into their lives, sort of abroad. Not everybody. MSF is a great organization. It's just a big time commitment for a lot of people. So,
yeah.
Dr. Driscoll, do you want to talk about how kind of you got into it? And I think a very common question for people is how you find out about it. I know some people go to conventions and they see agencies that can help connect you, but how kind of your journey?
That's exactly how I got connected, was through like a conference. It was in Toronto. There was a family medicine forum, and you know, you get a stamp like for visiting the booths. So we went to go check out the booth to get my stamp, and and I just kind of gave my information, and I actually stayed connected with one of the global medical agents for 2 years. And you know, Dr. Weissman, when you were saying how it's just the location, right? Because you're like, okay, like you're just trying to find the location that fit, right? Or like the job description that fit. I was more looking for something more of like an urgent care setting, or like an emergency medicine setting, or also to the other thing that was like every time, like, is the global medical staff agent would like send me, like, also I was based on like the location, like where is it, like where is it, like is it going to be good for my family, is it going to like how close is it to a beach, you know, like what is it around it, so that we can kind of like, because my idea was I'm going to go on this venture, work, learn a new culture and how medicine's practiced in a different place, but I also want to enjoy my downtime. So where is a good location where I could do that as well? So and then when the one that I went to this well, last year, it was just like a perfect fit. So yeah, that's how I got into it. Just 2 years of emails back and forth, and then being like, okay, let's do this.
Yeah, it really, I think it really adds a big dimension, I think, to people's careers. I think a lot of us in the States sometimes feel locked into our jobs, and I think some type of variety. Do you guys both, I know a burning question a lot of people ask is like family. How do you transition? Because I know I always get the question about me doing locums. How does that work with the family? Do they come with you? Do they travel with you? One of the guys I work with, his wife will travel with him to the locations around New Mexico and Missouri, and then she can work remotely. But for you guys, how is it like moving there, and how do they adapt and things like that? Dr. Weissman, you want to field that one first?
Yeah. So for me, you know, with my daughter being in college, and I don't have a partner, so it was really just me. And yet I still did consider, you know, the aspect of, you know, having my daughter come out for Christmas and so forth, which was very, very easy. But, you know, for me personally, that's probably why I didn't do it earlier, just because, you know, there were just so many commitments. You know, in the family. But maybe Jenny can speak more about, you know, how it worked out for you.
Yeah, so, so I took my 2-year-old and my 6-month-old with me. So, and my husband. So there's 3 of us. And so luckily my husband's has always been really supportive. And even when I would do locums in Ontario, pre-babies anyways, but he was actually totally game. And luckily enough, he actually worked remotely from New Zealand, and took care of the kids while I went to work. And one of the reasons locum in New Zealand is that I could work in the evenings. So because there was a shift work at an urgent care. So then I could spend the whole day with my kids, and then leave off to work. And then my husband would be able to do more of like the bedtime stuff. So, and like when they're 2 and then when they're 6 months, they're very portable. You know, they can't, like, they don't really kind of, they can't, you know what I mean? You just pick them up and tell them where to go, you know? But like, and we had my daughter, at a daycare, also so that she could be like socialized with other little small people. And that really helped too. So that it was like, there's definitely, there's ways to like bring your kids with you, even when they're really tiny.
Right. Wonderful. I just had the joy of becoming a homeowner. And I think a lot of people want to know, for your house, if you buy, do you rent it out or do you sell it, or how do you feel that one, Dr. Weissman?
Yeah, you know, again, for me, the timing was kind of perfect because what I decided to do when I left my permanent job was really get rid of 75% of my worldly possessions. So I got rid of my house. I put all of my things in storage with the intention of, you know, going out and doing the humanitarian work intermixed with locums. And that was I must say, it's an incredibly freeing thing to not be bogged down with stuff. So of course, I still have some of this stuff. And, you know, my mom has been very nice about letting me store things at her house. So that's kind of become my home base. And aside from that, I'm not really tied down.
Kind of a minimalist lifestyle. I like it.
Yeah.
I feel like I could get out of my suitcase and my backpack since I spend so little time in this house anyway. Dr. Driscoll, how about yourself?
So in Toronto, we've been renting.
Okay.
So that wasn't an issue, and our lease was up with our rent. And my landlords were really were easy and just said, okay, we just need an extra 2 months for our lease. So we, again, same thing like with Dr. Weissman, we just put things in storage. The hardest thing that we had to do was just find a place for my dog. So my parents were luckily able to take care of my dog. They live in Alberta, which is a 3.5-hour plane ride away. So they just took him. So that was just my biggest stress, is who's going to take care of our dog when we were away. So that was we didn't have to worry about our house.
Okay.
And it's worth noting that that is one thing about, working in New Zealand. It's really quite difficult to bring a pet because they
Mhm.
have very strong sort of quarantine, procedures. And so I had two cats, but, as life would have it, one of them had passed away and the other one, my daughter ended up taking to college. So it worked out. But yeah, if you have a pet, it's a little tricky.
Yeah, yeah.
Yeah.
Um, I know a lot of people want to know, and I do emergency, and so we don't really have the call aspect of things, but what is call like there when you're there? How many hours are required? And I was told in Australia and New Zealand, and please correct me if I'm wrong, there's like a limit to how many hours you're allowed to work or something like that. And correct me if I'm wrong on that one. Dr. Weissman, you want to fill that one first?
Yes, yes. There is, I think, a limit because, for instance, in my contract, at least, they talk about being paid overtime if you put in hours, above the 40 a week, which, isn't the case here usually in the US. But I must say that one of the things that I love the most about the work, and, this may be to some extent site specific, but I found the work, the life, work-life balance really wonderful in the sense that my particular clinic did not have any call duties. And so it was really outpatient only. And the other thing that I found really striking is that they really stuck to the hours. I mean, at 4:30, the place would just close down, barring a total emergency. They were pretty organized about. I mean, certainly they got in people that were sick, with same day walk-ins and so forth. So, I mean, people were taken care of. It was very rare for anybody to be turned away, but it was just very, very reasonable as far as, closing on time and not having sort of any extra hours. And I think that one of the things that makes that a little bit easier, I don't know if you found this too, Jenny, but in New Zealand is that the paperwork I thought was really considerably less. I mean, they use an EMR, and so of course you're still responsible for documenting well and so forth. But I think there's less of an emphasis on sort of like, writing in all those elements of a review of systems and all these sort of things that I think that we go through in large part, perhaps because of liability. That's not, I mean, certainly they're very responsible and the standards are very similar, but I think there's a lot less paperwork and that makes for
Yeah,
getting through the day more efficiently.
yeah, absolutely.
Yeah.
Dr. Driscoll, how was your experience? Do we have a special guest appearance from a family member?
He's just watching the Wiggles right now, but
Ah,
he was just standing very dangerously, looking like a head injury on the chair. So I had to grab him. So no,
we got an ER physician on call here, so we can do a video consult if we need to.
So for my place that I worked at, there actually wasn't an on-call. It was an urgent. It was a 24/7 urgent care. They were actually quite well staffed. They always had almost like four physicians on at a time, except at overnight because it was quite busy. So there wasn't ever. They didn't have a call system because they were quite always well staffed. So if there was the rare occasion that they needed to call somebody extra in for extra manpower, but then it would be like a group text in the group to see if who was available for even covering about 2 to 3 hours. But yeah, I didn't know we didn't have any on call.
Okay, wonderful, wonderful. I know a big question for a lot of people is definitely the financial side of it. Like how salaries, was it comparable here? Was it less? Was it more? Did you have to take a huge hit? Did that involve planning? And could you guys both, just kind of second part of that, talk about how you chose where in New Zealand you wanted to work, or if you didn't choose, sort of what it was like where you were working? Dr. Weissman, if you want to start with that one.
Yeah. So I chose the location where I worked, which was Huntly West Medical Center in the town of Huntly, New Zealand. That's on the North Island, and it's about a half-hour highway drive from Hamilton, which is one of the larger cities on the North Island. And I chose the location because it was largely Maori population. And that was really one of my sort of guiding interests for going to New Zealand. So I chose the North Island because it has the largest population of Maori, and then the particular clinic in town for the same reason. As far as salary, in the locations that were discussed with me, there wasn't a huge variety, and it was pretty similar. There were a few variations, but not huge in the pay. And I would say it's definitely less, than what you make here in the US per hour. But I found that, the fact that the housing, you get a car to use. You have to pay for the gas, of course, or diesel, but, and the house, comes furnished with all the stuff that you need. So you don't really have expenses for, to have to get stuff. So I found that, in large part, made up for the fact that the pay was less. And I mean, my guess would be that the pay was somewhat comparable with what, people there would make, which I think is probably less than what people make here in the US.
Sure. Dr. Driscoll, was your experience similar to that as well? I think you might be muted.
So I would say that, when compared to my salary here in Canada, I definitely took like a 50% haircut when going to New Zealand. But I found it didn't feel like I still, like the money that I made was more than enough for me to, number one, like save and have money to come back with. And also too, like it really does help with having, like we had a $500 like a week stipend for living expenses. So I never found it really like, I was there more for the experience than to make money. When I thought of it that way, then I wasn't too concerned. I didn't have to spend any, I didn't have to bring any extra, I didn't have to work extra more before coming to, so that I'd be able to compensate as well too, prior to coming. It also helps too that they pay for your flight. They give you X amount of money for your flight there and back. So that also is like an expense that helps as well to pay for expenses. And then also COVID-19 hit, and we didn't go anywhere, and for like 6 weeks we were locked down. So we were like the only money we were spending was on like food. So yeah.
Right. Yeah. For all the downsides to COVID-19, I think it's made people save money not traveling and things like that. Oh,
completely. And there was a lot, and the thing is, there's a lot of stuff free to do in New Zealand. Like that was in terms of, I think the part of the other questions is like the location you chose. We chose Hamilton because it's very central. It's an hour. That's where I worked. It's an hour and a half. No, like an hour to an hour and a half, depending on traffic, to Auckland. It's very close to. It's very central to get down to like the middle part of like Rotorua to get to like it's pretty quick to get to New Plymouth, which is like a beach town area. There's like it's 30-40 minutes to a beach, to a beautiful beach. So that's one of the reasons why we chose it too, because it's central and close to a whole bunch of different other big locations that we could travel and explore.
Wonderful. For both of you guys, Dr. Weissman, maybe first, I know for all the places that I cover, the credentialing and state licenses is just such a headache. And I know agencies help really to facilitate that, to make it easier. Is it really a huge burden, a lot of work getting an international license, learning a new system? I'm assuming things are paper charted there, I guess.
Yeah, no. So the whole process of getting credentialed, I found, was very, very easy, particularly since Global Medical just takes care of everything. And, basically would just send me things to sign. And you've been a locum, so you know that every time you've got to produce all these papers, you know, all over again. And so it's good to have them somewhere on hand, or,
Right.
you know, photos like easily findable on your computer and so forth. I mean, I think probably the hardest part of the whole process for me was that I did have to get a medical exam, because, and I think that might have been because I've been working outside of the country. So I did have a physical, and it had to be like at a certain place, and I was working in Panama at the time. So I had to go to Costa Rica to get this medical exam at a, you know, at a place. And I'm sorry, and I should say that had more to do with the visa. So for the working visa, that was why I had to get the medical and the TB clearance and so forth. And so that was probably, you know, the only hurdle. Aside from that, and to tell you the truth, I'm getting ready to go on a locums assignment next week to California. I had to do far more paperwork, and, you know, yeah. So it really wasn't bad at all.
I guess it's a nice thing for abroad. I guess the agency has so much experience to kind of link you up, set you up, tell you what you need to fill out, things like that.
And I think we did have an EMR. Was that part of the question? I mean, once I got there to work, we did an electronic medical system. Yeah.
Okay. Driscoll, is the experience same for you from Canada?
Yeah, I would say that Global Medical made it so easy. I think if I had to do the paperwork by myself, I would be super stressed out, making sure that made sure I checked the right boxes, that I filled out everything correctly. But it was literally, okay, make sure you fill out, like, fill out this part, you know what I mean? Send in your CV, and it was, I feel like it took a lot of the stress out of application. I wouldn't say it was stressful at all. It was just, again, making sure you have your, like, a scanned copy of your, like, of your university degree, of your medical degree, and just getting that, like, that was the more hassles, that having to scan some of the documents so that I could produce them for Global Medical. But it was just checking off boxes, and it was quite easy.
Right. Well, I think Dr. Driscoll mentioned the COVID pandemic. I don't know if you guys were there. I think one of you guys was there. One was there before. I'm sorry about that. I know in the United States, it was very challenging, as everybody saw in the news. We were, you know, running out of masks and gowns and wearing trash bags. We're using N95s, trying to understand quarantine issues, bed situations, boarding. So I think the US was obviously behind the 8 ball, and we were all, as healthcare professionals, sort of struggling to learn about the virus and sharing information with each other. How was it there for you guys? How did the country respond? I know Dr. Weissman and I were talking before, she was mentioning a shortage of ICU beds in the country. Yeah, Dr. Weissman, that's a very general question, but yeah, what was it like to experience there?
You know, I think that the early days of COVID were very similar to how they were here, in terms of just the uncertainty and, you know, the fear, not just on the part of the people on the whole, but, you know, the fear of us, the medical professionals, as we didn't know, you know, what we were facing and how fast it was all going to take off. And I remember in particular the last 2 weeks before we went into lockdown, just how, you know, how, for lack of a better word, I mean, it was really quite scary. We had, you know, there are a lot of respiratory illnesses, and there's very high prevalence of asthma in New Zealand on the whole, and particularly in the area where I worked. And so it was not uncommon in a week to see, you know, many patients with coughs, and other respiratory symptoms. So we were having patients come in with these symptoms while we knew that COVID was out there and the cases were multiplying. And there was the same concern about PPE. You know, we were not initially wearing a disposable mask with every patient, nor were the patients wearing the masks. I mean, that took a few days to get that all going. And there was also that sort of sense of trying to save, you know, the PPE, because we didn't know what was coming later. And, you know, I'll never forget that feeling, especially, you know, going home that final weekend right before lockdown and thinking, oh my God, what is next week going to be like? And then I got this call Sunday, which was just a huge relief, saying that, you know, we're going to go into full, you know, lockdown mode. And we're going to go to telemedicine, and we're going to do all the safety procedures, and so that was really probably very similar to what people were facing here. I think what was then different was that once we went, New Zealand, as you might have heard, had a very strict lockdown that they went into. I think it was toward the end of March, and I think that it was stricter in the sense that there were a lot of sort of rules, and it was very carefully spelled out. And perhaps, what made it also different from here, and, now that I'm back in the States and, we hear all this stuff on the media about what's going on and people's opinions, I think there's a stronger sense of protecting the community. And there weren't as many issues around, people refusing to take the precautionary measures, because I think there was a real sense of we're all in this together. That's the national sort of discourse, that comes from the Prime Minister down. And, the message was, be careful, take care of others, be kind when you're doing it. And it felt very different there. I remember coming back here and immediately sensing that it was not like that here. Yeah.
Dr. Driscoll, how about yourself?
Yeah, I completely agree with everything. It was like, it's all about family. It's about, like, in New Zealand, then, like, the words like wanu, your family, right? It's all about the family, being kind. And I felt like the people, like the New Zealanders, were all about community, and people were really, people were really proud when, like, they were essential workers, especially in like the really tight lockdown. Like, they were part of the food supply chain. They were helping the community. They were, like, there was a sense of pride in the people for being, like, for helping the country out, and by doing their part. Where when I felt like a little bit of a culture shock too when I came back, where they're coming back to North America, where people just, some people just didn't care, or didn't even think this was like a real virus, or this was like this is all fake, right? So where I feel like New Zealanders really embraced the idea of we're all in this together, and like you said, it was all like top down. It was all coming from like the Prime Minister, and you literally, and when things weren't like clear, the government made it clear, you know what I mean, in terms of what the expectations were, what you were doing in level 4, what you were doing in level 3, what you were doing in level 2. And it's like, it was in the newspaper. It got, like, literally, you could not watch a TV show without an interruption of being like, we're in COVID level 3, and then what you couldn't do. It was like, it was played every hour. Like, so it's just, it was like, there wasn't, and people, and I would say majority of the people, obviously there's the small amount of people that don't buy in, but even then, though, that got shut down like really quickly too. People, I feel like the government broke down, like clamped down on the small few people or the businesses that weren't complying. So yeah, I felt, but Dr. Weissman, everything you said.
Mm-hmm.
Yeah, you guys just want to both comment, like, what you think they did better or was more advantageous than sort of what we did. Like I mentioned, I feel like the United States was talking about it, but not as much. People were serious about it, but not as much. Obviously, the huge toll it took on the U.S. economy. I know somehow politics and science got intermeshed together. I don't know how that happened in the United States. But I know Dr. Driscoll mentioned like the constant information source and the leadership from the Prime Minister, and more people sort of taking it seriously and understanding it. I'm wondering if were they also sort of emphasizing the lack of resources. I know here Houston is having a surge, and I'm hoping getting over a surge, but really lack of ICU beds, and really nowhere to transfer some of these patients. So what did you guys feel they were additionally just doing better, maybe different from here?
Yeah, so again, I think that the biggest difference was the united front. And, I must say, I mean, there's politics there too. And, the leader of the opposition would sometimes question, some of the decisions that were being made around COVID by the Prime Minister. But, by and large, it was really a united front, and just, just incredible modeling from the top down about, concern for others. And then, yes, there certainly was a fear as far as lack of resources because, New Zealand being quite small, they really only have a few hundred ICU beds and ventilators, on, both islands together. So, with the big unknown looming and, not knowing if there are going to be thousands of people immediately, needing these beds, it was terrifying. I mean, it was really, we were facing the possibility of like a huge percentage of the population getting wiped out. We just didn't know, that's kind of what the fear was. And again, that's why too, there was this hoarding of the PPE for later because we didn't know what was coming later. But overall, I think, there was this incredible cooperation. There was this very strict lockdown. And as many of you have heard, they were able to get the cases down to 0 for like 100 days and largely go back to a fairly normal life. And now they've had, a resurgence of some cases. And more concerningly, it's community spread because there were still people, you may or may not know that they closed the borders. That was another critical part of the response, was closing the borders. But of course, they still had to let their own citizens come back. And so those people, the permanent residents or citizens that were returning, initially they were allowed to go into quarantine sort of on the honor system. And very soon it was clear that wasn't going to work. So then they were literally putting them in managed quarantine. And then, just to make sure that people actually did it properly. And you may have read that now with this resurgence of the few cases, it's not entirely clear where this community spread came from. So it's, it's a bit of a mystery, but they're trying, I think, again, to try to stamp it out as soon as they can.
Interesting. Dr. Driscoll, and I'm wondering, Dr. Driscoll, if you want to talk maybe, because you're based in Toronto, I believe, is that correct? Or in Canada?
Yeah.
You want to compare about, how New Zealand, but also in Canada, how has COVID been managed? Do you feel was done better? Maybe could have improved based on your kind of locums experience across, 2 different countries?
Well, I think I found New Zealand shut down very early. I still remember it was Sunday. It was like 110 cases, and they're like, okay, we're going in 48 hours. Like we're going into level 4. Like it was the lockdown to like the very like strict lockdown happened very quickly. I feel, and again, it's the communication part. It was very clear of what was happening in Canada. There's just like you're getting a different, like Canada's still doing it's actually been doing an okay job. Like the numbers are low, but we are getting a little bit of, the numbers are creeping up because people are being a little bit more lax with the social distancing. But I'd say one of the issues in Canada compared to New Zealand, I found was that it's, again, the communication is that people are getting so much are getting different information from different levels, from like the federal level and from the provincial level, and then also from like the city. So there wasn't like people were saying similar things, but people don't know what exactly what to do. So where I found New Zealand's, the communication was very clear, was crystal clear. Like you couldn't, like you could read it. It was on it was again on the TV all the time of like what you need to do. And like also too with like, and I know a lot of places, like, I don't know about how it was in the US, but there was always like that, like the every day, or like during like Monday to Friday, Jacinda Ardern and Ashley Bloomfield would do an address to the nation about what was happening. And in Canada, like they're doing the same, they did the same thing, but it was just very, it wasn't, I feel like the communication wasn't still that great. You know what I mean? Like it wasn't very, and this is awful, but it wasn't very entertaining to watch in Canada, where I feel like Ashley and Jacinda Ardern were like, made it very clear, and their communication was like was excellent in terms of what the situation in New Zealand was and what you need to do.
Right. Absolutely. Absolutely. Well, I'm going to ask some logistical questions people wanted to know, and of course, maybe some drawbacks. I think a lot of people were wondering, was it hard to find a home there? And really also about insurance issues, like do you get health insurance? Do you get covered there? If you have an issue, what happens? I'm assuming Global Staffing Company or the agency you're with sort of covered that part of it.
Mm-hmm. Actually, that's a really good question. And with regard to health insurance, it was really worth doing some research. I think Global sent me a list of companies that provided insurance, and there was a huge price difference between getting, say, an international travel health insurance plan through an international company or an American company, or getting health insurance through a New Zealand-based company. And it was literally just, I think it was like a few $100s for a whole year if you got it through a New Zealand-based company. Now, of course, that wouldn't cover you if you traveled outside of New Zealand during your year. Although I think mine covered me in Australia, which is the only place that I went to while living there. So it was totally worth it and not very expensive. So yes, that was not part of the compensation package, but it was quite affordable. And I'm sorry, was there something else besides the insurance?
The
Handy housing.
Yeah, and also I'm going to throw one in there also. I was just thinking also about language barriers, because when I work in Haiti, we have, thank God, we have our Haitian translators, but you don't, when you do global health work or even international locums, you don't think about those roadblocks. And when we show up and we have a day that our translators are late, we kind of all just stand there and look at each other. Yeah. So was language a barrier there as well?
Well, so there a large percentage of the Maori people do still speak Maori, and in fact, there's a real strong interest in preserving the language, and some of the kids go to like Maori language immersion schools in order to do that. But by and large, most of the people are bilingual. The people who do speak Maori are bilingual, so they speak English as well. So no, there was never a need for a translator. Although that being said, there are also people there who have immigrated from other countries. So once in a while, I saw people from India or other countries that who needed translators for that language. But it wasn't common, not where I was living. And as far as the housing, that was something that and I think in most cases, the site that you go to work for finds you a place to live before you get there. So that was the case for me. They had already rented me a house. And then when I got there, they did say that if I didn't like it, they could certainly find me. I wasn't locked in. I could have moved. And really it was very comfortable. I mean, the only thing I would say, and I don't know if this is the case for other locums, is that most of the houses there don't have central heating. Air conditioning is not a big deal because the summers are not terribly hot, but the winter gets somewhat cold. And so I found that I probably needed more heat than the average New Zealander. So they got me a few room heaters, and that was good for me. I was fine with that. So I ended up staying in the house that they rented for me, and it was really quite comfortable.
Yeah, my sisters both live in San Francisco, and I guess there's no ACs in their home, but they spent all their money on heaters. So
Yeah.
was cool, but. Just all about yourself. So things like the housing was a challenge.
Yeah, and then for the insurance, so we got insurance for the entire family. It was actually, I'd say, it was from one of the lists that Global Medical gave us. Okay. I still remember it was actually for 4 of us, and also to for health, for cancellation insurance, and for things like it would cover you for dangerous activities, like if you decided to go bungee jumping. If you wanted to do adventure activities, you could add that to the coverage to it. Or if you wanted to go skydiving, it was 653 New Zealand dollars for our entire family. So very reasonable. We had to pay it on our own. But I thought that was quite affordable for the time that we were there. Now, in terms of for housing for us, for in our situation, we actually they provided us an apartment for 4 weeks so that it would give us time to find a place on our own. So we went through we were able to find something. I guess the hardest part for us was just finding a place that was furnished. It wasn't, the furnished places were a little bit more expensive than the unfurnished places, but we didn't have any difficulties finding something and signing up for a 7-month lease with a landlord. And I guess, and also too, the one thing that we had to do that was maybe different from Dr. Weissman is that we actually bought a car during the time we were there. And then, because we found when you're in terms of looking at the finances of it, renting a car versus buying a car and then reselling it afterwards was easier. So that's what we did, and there wasn't any issues with that. And we actually, it actually would have cost less for us. It would have cost less for us to buy it and then sell it than it would have to have rented a car for the 7-month period.
Okay. I'm just curious for both of you guys, what kind of pathologies did you see there? I've been told going to conferences and international conferences, like things like trauma. I work here at a level 1 trauma center, but the trauma, the gunshots, the stab wounds, last night we had a major fatality, car wreck from, high speed and texting and driving, things like that. And then the emergency room, what did you all see out there? Dr. Weissman, if you want to start with that one.
Yeah, so mine was, a primary care setting.
Mm-hmm.
And I would say that it was really quite similar in many ways. I had been working in a community health center that was primarily for Native Americans and uninsured people in Phoenix, Arizona. Mm-hmm. And the daily work was very similar in the sense that, you see a lot of diabetes, hypertension. One thing that I really enjoyed was that my practice, much like other settings that I've been lucky to work in, did include lots of children. So I've always, had a lot of children in the practices that I've worked in. So everything from, preventive care to acute visits. I think the one thing that really struck me as different in primary care was I mentioned earlier, just the tremendous amount of respiratory, both in terms of like asthma and COPD, but also just infections. I mean, they have a really big problem with acute, streptococcal pharyngitis. So it's so important there to get a throat swab or just get treated with penicillin because, they still have people that develop rheumatic heart disease. So that was one thing that really struck me. The other thing that struck me was how many skin infections, just infected wounds and cellulitis, and also just acute gastroenteritis. So I think that was something that was incredibly striking about how the variety in New Zealand, that there are parts of New Zealand where it really is very much like, another country. And that was the case in the community where I worked. Yeah.
How about yourself, Dr. Driscoll? You were doing urgent care? Were you doing A&E also, emergency medicine?
No, I was just doing it in urgent care, which was kind of like the equivalent of like a subacute.
Okay.
In Emerge. So like I agree, there was like so much asthma, like it was like insane, like the amount of people coming in with like bad asthma exacerbations or COPD exacerbations. That was, and in Hamilton too, there's a lot of factories. So we saw a lot of MSK stuff. So a lot of broken bones. So we would manage that. Anything that would get too complicated, it was so nice because the hospital was just a 5-minute drive up and we had a good relationship with the hospital. So if anything that was a bit like was getting more like acute, the need that we would literally just call an ambulance and send up to the hospital. Yeah, I get, but everything like you said with Dr. Weissman, lots of infections, so many skin infections. Like they call them like all. It seems like all like I don't know. They call them school sores. We don't call them there in Canada, but a lot of kids with these like boils everywhere, more than I see here in Canada. And again, also too, that like you were saying with like the strep, with strep throat, like automatically, like the guidelines are, if they're MARI, you treat them with a penicillin because they're such at high risk of developing like rheumatic like fever, rheumatic heart disease. So like you just like if they're MARI, sore throat, fever, you give them a penicillin.
Mm-hmm.
Oh, interesting. Interesting.
Yeah.
Well, do you guys want to talk maybe just a little bit as we wrap up here about kind of what you did for fun? I mean, when I started way back, well, not way back, it's like about 6-7 years now when I left residency, but when I started doing locums work, first in New Mexico and then Louisiana, Missouri, and Vermont, I just found all these interests that I never knew I really had, maybe because the whole medical training here in the United States sort of crushed all that for me. But got more into like hiking, music venues, sports, mountain biking. So what'd y'all do for fun out there and that maybe couldn't have done here?
Yeah. Oh goodness, it was incredibly fun. It's hard to know where to start. I sort of got a reputation as a great traveler. The people in my office couldn't believe how much of New Zealand I saw, just on the weekends and the short periods of time that I took off, over the holidays. So, as Jenny mentioned, because we were in similar geographic areas, central North Island, it was a really great jumping off point for seeing the rest of the North Island. And so that was great. I mean, you could easily on a weekend, see, but for the very far north and the very far south, you could get pretty much anywhere. So I made the most out of the weekend, certainly. And then when I had a little bit longer time off over the holiday period, I went down to the South Island and saw most of that too. So it was great. And then even got to Australia. So traveling was a huge part, of the fun for me. And I must say that like some of the things that I now do because of living in New Zealand are just amazing for me. One was that I became an incredible walker, which I never really had taken advantage of before. And it turned out to be perfect because now with COVID, I continue to walk, 5 to 10 miles a day.
Wow.
And I started that in New Zealand before COVID even came around. It was just so fun to walk there, in a variety of different settings. So that was a big thing. And then I must say that if you go there with and have like certain interests or hobbies, you can continue them. So for me, one of my greatest interests is painting and drawing. And it was really easy for me to find an open studio where I could go and draw and, live models, and then also an art school where I could take workshops. So, and then I even sometimes traveled to Auckland, which wasn't too far, to take a special art workshop on a weekend, that kind of thing. And the nice thing about getting involved in those interests was that I met people, I met people at the art studio, and I met people, I continued taking French classes, which I've been doing for a while. And I actually am still doing French class on Zoom with my New Zealand classmates, because, with COVID, the classes went on Zoom and I was able to continue. So, and I must say I made, in the relatively short time, 9 months that I was there, I made, I would say 3 like pretty good friends. I made certainly friends at work. I felt like the people that I worked with were really, really lovely. So accepting of me and offering of, just friendship. So I certainly made friends at work. And then I also made friends through these hobbies that I was pursuing.
Always amazing the people you meet when you travel doing locums and the friendship that you kind of form from that. So
yeah.
Dr. Driscoll, how about yourself?
So I think anybody who is really outdoorsy, like me and my husband, go to New Zealand, do a locum, because there's so many outdoor opportunities that are like, the hikes are phenomenal. Like for us, even though we have 2 small kids, we bought backpacks, like hiking backpacks, strapped the kids on, and would go for some pretty amazing hikes. Also too, the beaches were like unreal. They were probably some of the most breathtaking like beaches that I've ever been to in my life. So we did a lot of that during our downtime, was beaches, hiking, seeing different natural, like New Zealand has all these like natural wonders. Like there's places where it's like they have a lot of like volcanic activity. So there's a lot of geothermal, really cool spots to go see. As well, they have these amazing like glowworm caves that were really cool to look at. So and amazing waterfalls everywhere, like even just everything is so drivable in New Zealand and well marked for you to go. It's you really like, I think you could, like, people who go only for 2 weeks to New Zealand, it's not enough. Like you really have to go for a long period of time to kind of really get yourself into to not just like the big tourist spots, but to off the beaten path places. We unfortunately weren't able to go to the South Island because of COVID. Our plan kind of got cut short, because when lockdown happened, we were supposed to actually do 6 weeks in the South Island, but that never happened. So, oh, and I wanted to say too, like what we got really into in New Zealand was the coffee. The coffee, if you were a coffee person, New Zealand has the most amazing coffee. And like every barista makes it differently, and you would think that there is a difference, but we really got into cappuccinos and flat whites when we were there. So it was kind of our thing every time we would go to a new place, to a new city, to try different coffee locations.
Great. Wow, this is great. I'm getting really sad I haven't traveled in so long because of COVID. Getting nostalgic about traveling.
Yeah.
Well, thank you both so much, guys. This was really interesting. So fascinating. I've heard so many people had such incredible experiences culturally and recreationally into this kind of work. So I think it's really relevant for so many physicians of all specialties. If you, in the future, check in here every few weeks, Locumstory is doing these types of webinars, so please check back in. I believe you can still submit questions for our 2 wonderful speakers that they can answer later, I believe, on the website. And thanks so much, guys.
Thank you.
Thanks,
and
guys.
do it.
Thank you. Oh, completely. I would, any advice to anybody I would say is that, like, if you're thinking about it, do it, because it's worth it, and go for longer than you think.
And there's still people, even though, with COVID, I mean, or even more because of COVID, they still have a great need for doctors. So you can apply right now.
Yeah, get out of your comfort zones a little bit and try something.
Completely.
What you find. Okay, guys. Thanks, guys.
Bye.
Bye.